Does one need further tests for them to know that there is a difference between one lump and another?
Yes, so it's very important to remember that all lumps in the breast are not cancer. Majority of the lumps are benign, but to know whether it's cancer or not, a screening mammogram has various features wherein the radiologist will be able to tell whether the probability of cancer. So if the mammogram is suggestive of a cancer, then further testing like a needle test, which is called FNAC, or a biopsy is performed. So having said that, all lumps in the breast are not cancerous, and women should not fear getting themselves tested, the fear of cancer.
All right. There is also the question of age. Is there a recommended age as to where one should be more keen and go for more tests?
Yes, that's very important. It has been shown by various studies that screening is useful beyond the age of 49 years. So you start screening from 50 years onwards, and depending on the society guidelines, annual or every 2-year screening mammogram is recommended. This is for average risk patients. When I mention average risk, it's the risk of developing breast cancer, which is less than 15%. There are few women who have a genetic predisposition to breast cancer. They have a strong family history of cancer. In them, the annual mammogram and annual breast MR is also recommended. So it all depends on the risk which a particular woman has.
All right.
So more the age, the more the risk of developing breast cancer.
Okay, there's also the question of diet. And when it comes to what we eat, do we predispose ourselves to higher risk depending on what we eat?
Yes, definitely. More of red meat, more of oily food, saturated fat, less fruits and vegetables predisposed to various kinds of cancers. Then the number one culprit is tobacco consumption in various forms, alcohol abuse. So these all are important factors that can predispose anybody to develop cancers.
Okay, and I've also had, and I don't know how true this is, and maybe you could guide us on that, that some of the food we're eating, despite the fact that it is ideally healthy food, for instance, greens, the fact that there are certain chemicals used on them while they're being grown could predispose us to risk. What are your comments to that, and how do we go about that?
Yes, definitely. Use of pesticides and various other chemicals can predispose to cancers, especially the leukemia, acute leukemias. So they are known to cause cancers in people. And rampant spraying of pesticides while farming, this is another important cause. Use of various antibiotics and other chemicals in poultry, this also predisposed to various kinds of cancers. So all this should be regulated if not stopped.
Okay. Now, November is normally also a month which is used to bring awareness for prostate cancer, and possibly going through the same, set of questions, starting with the fact that what does one need to know as a man, in regards to prostate cancer? What are some of the things that you could look out for?
So prostate cancer, again, the incidence of prostate cancer increases with age. The more old the man is, the more risk of developing prostate cancer. Luckily, there is a easy screening test that is available, which is called the prostatic specific antigen blood test, PSA test in short. So beyond the age of 40 or 45, annual PSA screening can be done, and ultrasound pelvis can be done to see the prostate size. But not all prostate enlargement is cancerous. Most of the time it is because of a benign enlargement, which is called BPH. And men need to watch out for symptoms of prostate cancer, which can be blood in the urine, difficulty in passing urine, pelvic pain, or sometimes symptoms suggestive of widespread disease like bone pain, cough, or chest pain. So all these can be symptoms of prostate cancer. Okay,
and I know the discouraging point for many men was, how it was tested previously. Has there been any development on that? Is there non-intrusive methods of testing for cancer, for prostate cancer?
So non-invasive for prostate cancer would be doing a PSA test, which can easily identify most of the prostate cancers where there is elevated PSA. And then you can do a scan, you can do ultrasound scan or a CT scan. And only if there is enlargement of the prostate, then a physical examination would be required, which can be sometimes uncomfortable.
All right. And generally speaking, in terms of cancer, are there ways that one can tell? Because maybe you've not gone for the test, but are there ways that one can tell that they need to urgently be tested, be it breast cancer or prostate cancer or any other cancer?
Yes. So that's a very important question that you bring. These are called the warning signs of cancer. So it all depends on where the cancer is. So any prolonged fever which is not subsiding could be a sign of cancer, weight loss, loss of appetite, difficulty in swallowing, blood in the vomiting, blood while passing stools, blood while passing urine. A lady who has attained menopause starts having bleeding again, any lump in the neck or in the skin, or any change in the mole, severe pain, severe headache. This all can be signs of various cancers. So it all boils down to what cancer we are dealing with.
All right.
But these are generally the warning signs of cancer.
Okay, sorry. What does exercise in any way help when we are trying to, stay healthy in regards to keeping away from cancer?
Yes, so obesity is one of the risk factors for various cancers, including breast cancer. So maintaining ideal body mass index, that is ideal weight to your height and sex, is very important, which can decrease the risk of developing cancer. Not only cancer, it's useful for reducing the risk of heart disease, hypertension, diabetes. So it has multitude of benefit having a good healthy lifestyle and maintaining your weight.
Okay, and we have questions coming through via Twitter. There is a gentleman here who's asking as to whether, delayed ability to urinate is a sign of that one might have prostate cancer. Maybe just to explain, again, highlighting on some of those signs.
Can you come again? The correction wasn't good.
Yes, sorry. There is a question via Twitter of a gentleman who says that he has sometimes delayed ability to urinate. I guess he may feel like going to, the toilet, but for some reason there is a delay in the urine coming out. Would that be something he should be concerned about?
It could be a cancer, but most likely it would be a symptom of a benign enlargement, which is called BPH, which is very common as you grow older. So difficulty in passing urine or going frequently to the urine in the night, they're all symptoms of BPH, which is a non-cancerous entity.
Okay.
But it would be prudent to get checked.
You'd recommend that he gets checked. There's also the question that comes in also in regards to herbal medicine. Once one has been diagnosed with cancer, there's all manner of, medicines that are available. One of them being herbal medicines and natural, ways of healing this. What would your comments to that be, and how do we verify which is more critical to take than the other?
So it is very easy. I mean, it's a natural tendency to take something that is simple to use or which is not costly. So when it comes to herbal medicines, there are no studies whatsoever which have proved that they're useful in any kind of cancer. So I would definitely not recommend herbal medicine for treating any kind of cancer. So the main reason that people choose to take herbal medicine is because they fear chemotherapy. They feel that chemotherapy can be very painful. It has very side effects, that people will die if they take chemotherapy. So these are all myths and fears that people have, and they need to be addressed to.
Okay, and what would your comments in regards to chemotherapy be? Because there are those who feel, I've seen articles written that chemotherapy literally kills all your cells, including the cancer cells, then you have to rebuild them again. Is that necessarily true?
Yes, so what you bring out is a very important thing, because chemotherapy, when it's injected, it's going to affect the normal tissues also. That is the reason side effects happen. But there are very good supportive care medicines that are available to prevent side effects or to treat side effects if they happen. Also, the oncologist is going to plan the treatment based on the patient profile. If he thinks the patient cannot tolerate the treatment, then the chemotherapy drug is modified accordingly. So most of the patients can take the chemotherapy very well without any major difficulty at all.
Okay, and your comments on early detection, because one of the things, and I think I picked from that particular feature that we ran not too long ago, is that many people fear that the minute you're diagnosed with cancer, it's more like a death sentence. Maybe just talk us through the importance of early detection and being tested.
So there is no doubt anyway that early detection saves lives. This is very important to know. And in a country like Kenya, for that matter, India, most of the patients are diagnosed in a very advanced stage. Almost two-thirds patients would be diagnosed in an advanced stage where cure is not possible. So if you detect the cancer early, you have a chance of cure. So cure is a very big thing in cancer. That means the patient can lead a normal life, and when it comes to early detection. So go see your oncologist as early as possible whenever you have any problem. So that's very important. Early detection definitely saves lives.
The other challenge that we have, Daktari, is that we have very few oncologists in the country. And maybe you could explain to us why this is the case, because that's part of what drives the cost for cancer treatment to skyroof, where many are not able to access.
Yes. So what you bring out is a very important aspect of oncology treatment in Kenya. There are very few centers. So what should happen? The county hospital should be equipped with at least diagnosing a patient of cancer so that they can be referred. So many times what is happening, the small centers, they are not able to diagnose cancer. They don't have facilities to perform a biopsy or do simple blood testing. And regional cancer setups should be set up in the countries where treatment can be done. They have a radiation facility, they have a surgeon, they have a medical oncologist. The cost of treatment should come down. So most of the chemotherapy drugs are imported from various countries, adding to the cost. The insurance should cover the treatment. Many times patients cannot complete their treatment because they don't have insurance or the insurance is exhausted.
All right, and your closing remarks, Daktari, as we wind up, we're out of time. Just your closing remarks, a general overview and advice in regards to cancer.
So I would tell the people that there is, you need to see the doctor as early as possible. The warning signs of cancer should be on everyone's mind, including the doctors. Whenever there is a health condition that is not improving, consider cancer and seek care as early as possible. And please take the standard treatment. Don't go for herbal medicine. Do your screening for breast cancer, cervical cancer, prostate cancer, whatever it is. Have a healthy lifestyle. Stop tobacco consumption in all forms. That's very important.
All right. Thank you very much. That's Dr. Lalit from Medihill Group of Hospitals, who's an oncologist. Thank you for joining us this morning on just highlighting on matters to do